Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. These topics will include spinal injury issues like neck pain, low back pain, bulging discs, pinched nerves, and sports injuries, lifestyle medicine, dietary and nutritional advice, nutraceuticals, and supplementation, just to name a few. We'd like to encourage you to email us about topics that you'd like to hear discussed on this program. You can do that by emailing us at imchiro1, the number 1, at gmail.com. That's M as in Mary, CHIRO, the number 1, at gmail.com. Doc, for the last several shows, we've been talking about specific topics, specific subjects, one subject,
that
basically.
is true.
Without heading down bunny trails, of which I am so fond.
Yeah, you're good at that.
I know. How about this week, we just talk about whatever comes to mind and a couple of things that have been mentioned to us that we can share on the program.
Sounds like a good idea. Maybe we can fill in some of the blanks for people out there.
Okay. So firstly, question from one of our patients, Michael. He wanted to know about the effect of, high impact sports in, specifically Taekwondo and those types of sports on young bodies, and how that may affect them later on, if at all. Is there some particular way they need to?
You're talking kids here, right?
No, I'm talking
children.
Kids. I'm talking 6 to
up.
Yeah.
That's a real
Little
concern,
ones.
in my opinion. I think too often we have our children involved in these more high-impact activities, jiu-jitsu, maybe martial arts, although those can be very good for young children because it teaches them discipline. A lot of times the activity of performing the actual art itself, is a stretching exercise, and in a lot of cases, I would imagine that they're not allowed to combat each other to impart a hit or a kick and that sort of thing. But I think the more concerning one to me would be football.
Well, before we get to football, and you're right, because I know. Particularly affected you in your young life. We'll talk about that. But I'm thinking of actually a client of mine for landscape design right now who has little tiny ones, 4-year-old in Taekwondo, and a 6-year-old. They're just the cute as a button little ones. And she came back and told me she broke a board. She got,
with her hand.
Yes.
Wow, that's pretty impressive for a little kid. And I've seen these 2 little children, and she can't be 3.5 feet tall.
Oh, she's teeny.
She's a tiny little girl. If they're taught proper technique and they do it properly with appropriate supervision, I can imagine that it's okay. I mean, is the potential there for the injury? Yes, I would certainly think
Always,
that's true,
I guess so.
Especially if they do it incorrectly.
Right.
But I would tell you that I don't know that I would have anything against that necessarily, especially if it's done under appropriate supervision. Okay. But I'd like to get back to the football one because I know football is fun. And I know a lot of these peewee football leagues that you have, they're in pads and they're in helmets and that sort of thing. And I would imagine the incidence of getting hurt is probably pretty low. But to me, the impact isn't one that's necessarily immediate. The impact is one that would be more of a long-term, what's going to happen when they're older with the accumulation of these injuries over a period of years.
Right.
That's why you see a lot of the football players getting knee replacements when they're 45 years old. It starts when they're 7 or 8. Now, I'm not going to tell you that I don't think kids should do that. That certainly is a parental decision that needs to be made. But I do think it's important that you understand the risks and the potential that can occur from the accumulation of injuries that these little bodies take.
Yeah, and not everybody takes or is impacted by an injury the same way.
That's right.
One person may, his knees may wear out at,
right.
In his 20s, and somebody else may be fine for.
There certainly is a genetic
ever.
component to this. Some people's genetic makeup allows them to withstand the impacts maybe or the long-term effects of a contact sport versus somebody else whose genetic makeup may not allow that.
Right.
That's why not every football player gets knee replacement when they're 45, but a significant number of them do. It's due to the wear and tear. The movie, what was it, Indiana Jones, the very first one, the Indiana Jones movie, when he's on the ship, Harrison Ford is on the ship, and he's kind of being seduced by his girlfriend, and as she's starting to take his clothes off, he's
this is a G-rated show.
And he's really grunting and groaning because it's hurting that she's trying to take his shirt off, and she was calling him a wimp, basically, is what she was doing, and he said, it's not the age, it's the mileage, and that is so true. It's not necessarily how old we are, but what it is how much we've been through in the course of our life. So it's the mileage.
When are they going to come up with genetic testing for how long a body part will last?
Oh my. Well, there certainly is some genetic testing available today, but I don't know that it would specifically relate to the body's ability to withstand the trauma of some types of contact sports. And I don't want to just pick on football. Basketball is another one as well. Any kind of long-term sporting event that requires a lot of higher, more extreme activity is going to take its toll over the number of years. But
well, speaking of which, you've got a left ankle?
Right ankle.
Excuse me, I should
right
know
ankle.
that. A right ankle that fusses at you every once in a while because of your basketball
career. When I was a younger man, I played high school and a little bit of college, and certainly rolled my ankle probably more times than I can remember. I've been in a cast several times because of my ankle injuries, specifically the right one. And you're right. It's hard for me to stand for long periods of time or to walk for longer distances without my right ankle letting me know that he's not a happy camper. And it's a direct result of the strain that I took, the extreme activity that I took when I played basketball.
Okay, and time out right there, Doc.
Okay.
You're a chiropractor.
Yes, sir.
You are a medical person. I'm a ma'am. And when you're hurting like that, when you're older, because of your history of sports or whatever it is, I took ballet and my hip's starting to talk to me.
Yes,
I hope
that'll happen.
I hope it's not in a bad way, but it's ballet dancers have ankles, knees, hips that they have to deal with. What do you do when you have something like that, or how can we help them?
That's a great question. The problem you run into is that the damage has already been done. And in a case of a joint like your hip or maybe my ankle, the arthritic condition is already there. The goal is to keep it from getting any worse, and then to treat it symptomatically to help the patient or the person to have a more normal life without the pain. So ice would be a good thing to do. And the other thing is to understand what you can and can't do. The activity levels that you undergo may certainly be altered because your body just can't handle it anymore. And there certainly are modalities, or physical therapy modalities, let me be more specific, that you can do. And one would be cold laser. It's a great therapy for soft tissue injury, joint injuries, and pain. I think laser cut its teeth on pain, as a matter of fact. And
boy, does that work. I can
How does
attest
that
to
work?
that. I said, boy, does it.
Yeah, it
I can
does
attest to
work.
that. Doing it right now on his
Yeah,
shoulder.
on a shoulder injury from doing that landscape design, right?
Yeah.
Yeah, I remember
Can't keep a shovel out of my hands.
a plantar fasciitis issue that I had on my right foot, if you remember.
Yes.
I could hardly walk because it hurt so bad. I'd get out of bed in the morning, and I'm sure our listeners, some of our listeners anyway, are going to be familiar with this. That first step upon arising out of bed on a plantar fasciitis foot that has that, it's like you almost fall over because the pain is so bad. But laser therapy pulled me through that in just a few treatments. So
Okay, another time out there.
Okay.
Yeah, I know that it did. I mean, laser's a wonderful thing.
Right.
But people don't really know a whole lot about it or know
That's
about
right.
it. And the other thing is, chiropractor's not the first person you think of when you have a foot problem, a plantar fasciitis, or a tennis elbow, or a golf elbow, or a carpal tunnel,
That's
or
absolutely
anything
true.
away from the spine.
That's unfortunate, but it's true.
Yeah.
People think, well, I need to go to the orthopedist, or I need to go to a knee specialist if I've wrenched my knee or my ankle. But
Right.
in our office, we certainly treat ankles and knees and hips
Lots of 'em.
and elbows and shoulders and wrists, plantar fasciitis, carpal tunnel syndrome. These are certainly the types of conditions and injuries that a chiropractor will see actually very often in his office once people realize that that's what we can take care of too.
And we're not just talking about laser treatment
No.
for those things. There are adjustments that you can make.
That's right. That's right. Extremity adjustments are very
right,
common. Sure.
Right. And ultrasound.
Ultrasound,
works.
cold therapy, ice, electrical stim, interferential current would be useful in these kinds of cases. And another important aspect is proper fitting shoes.
Oh, yes.
And that's I wear orthotics in my shoes, as well as I have some shoes from a company. I don't know if we can say the name or not, but
I think we can.
yeah, I think so. Well, Vionic
Yeah.
that we sell in our office, I know, and we utilize those for patients who do have knee and ankle and lower back problems, because the alignment of your feet and the alignment of your ankle is so very important. And unfortunately, I've been blessed with having very flat feet, look like duck feet when I walk on the beach.
No, you don't.
But having a good supportive shoe has been a godsend for me. And when I mentioned that plantar fasciitis that I had earlier, it was the Vionic shoe, flip flop, as a matter of fact, that kind of helped me pull through that. It was the only shoe that I could wear where I didn't have pain when I walked
Right.
with that plantar fasciitis. So having a good shoe is also very important. But these are a number of different things that we can treat, ankles and knees and all those fun things as well.
Right. And back to the foot thing with Vionic, I do not have flat feet. I have a very high arch. But boy, oh boy, I'm in my 50-something here, and
I wish I was.
standing in shoes all day, in patient therapy, being on my feet all day long, in regular tennis shoes. By noon, I was ready to be out of them, and with these, I can go for all day, all night, 18 hours, and now I'm collecting dress shoes as well, so I can wear them
Me too.
other places. Now we're so spoiled that we're replacing our entire
Shoe wardrobe.
inventory. Vionic loves us.
Yes, they do. They do. But I'm telling you, they work. And it is
So
so
it's not just for
important.
flat feet.
No, it's not. It's for all kinds of conditions. But, golfers get that golfer's elbow. Tennis players having the tennis elbow. We've had a couple of incidences of patients who have carpal tunnel from maybe driving too much, or they're working their mouse at their computer so much that they develop a carpal tunnel syndrome. And the modalities that a
Young
chiropractic
people.
office utilizes, the ones we mentioned earlier, cold therapy, laser, ice, interferential current, which is an electrical stimulation type of current. All of these things help patients to recover from these types of issues. So.
And it's not just older people who are coming in with these
no.
issues or these foot issues,
No,
by
not
the
at
way.
all.
It's younger people more and more because of that repetitive motion. Think your
Yep.
iPhone.
As a
Think
matter of
those
fact,
iPads. Or
I hope she doesn't get angry at
Ooh,
me
she'll
for throwing
call
her
you
under the
out.
bus here. But my daughter came in with a little bit of a carpal tunnel problem, and the way she noticed it the most was when she was texting on her iPhone. She would be texting, and then she's how young kids are. Well, she's not that young, but she's young compared to me.
Young adult.
Young adult. She started developing some pain in her wrists and numbness in her hands. And it was related to her texting. So we're seeing this in all ages.
And too, in that vein, there are a number of people, and she's one of them. We're going to have to call her and ask her permission to air this.
Make sure that she doesn't get mad at me for
She was fussing about her feet because
right.
she is on her feet and walking all day long as a clinical pharmacist.
That's right.
She is making rounds, and I mean, she does 12-hour days where she just, doesn't sit down, and she's standing up doing her work. And we got her in a pair of shoes, and she's
happy camper.
2 or 3 other friends at the hospital saying, "What are you wearing? And how can I get some?
And how can I get some?" Right.
So it's not just the older folks who are having, foot troubles. It's, people who are on their feet all day long.
That's right.
It's amazing the difference.
That's absolutely
good support.
correct. Yes.
And not just Bionic. There are other brands
companies,
out
sure.
there, and specialty products that you can buy. But we've found this one to be a real good one. We're happy with it.
Yes, we are.
Anywho, on
to the
on
next
with
the next topic.
To the next thing. Have we pretty much covered all of the sports things? Oh, here's what.
Okay.
Another thing about that dog. Someone comes to see us with any of those related issues. How do you know when it's time to refer out? Because we can't. We should be we're the first stop for everybody.
It's called a gatekeeper. That's right.
Right. We should be your first line of defense.
That's right. That's
before
correct.
you talk about the knife or
that's right.
The heavy drugs and the shots and all of that type of thing. Start with the least invasive.
Right.
Chiropractic, and then we'll move you forward, or you'll know when to move on if it's not working.
That's a clinical decision, certainly, and it's different depending on the patient's condition. But the bottom line is that it depends on whether the patient recovers or not. Recovery is obviously the key. If after a relatively appropriate length of time, I would say probably 7 to 14 days. If
well,
the
and you know that because you know what the average time is for
if the patient doesn't
healthy
get better,
restoration,
then certainly we
yeah.
certainly refer them out. And the more severe cases, like a patient who might have a severe low back injury with that shooting hot pain down their leg to their foot, for example, we might send them out to an orthopedist right away because we want to make sure that they're not so bad that they require surgical intervention, or if nothing else, just to get them some medication for the pain. But as far as when we refer, holy cow, I'm tongue-tied. When we refer, that certainly is a clinical determination based on how the patient responds to our care. But I will say, and if I might interject right here, and we've had this happen a time or two here recently, patients coming in because they have been offered surgery to repair a lower back injury, and they weren't quite ready or thinking that they were ready to have a surgical intervention. And neither of them or none of them had tried conservative management of their condition, things like chiropractic care. And in those cases, I think we've been able to save them from having to go under the knife because we've been able to resolve their condition. And I do want to make sure that I repeat that if I didn't think we were going to be able to resolve their condition, or if after a reasonable amount of time they did not resolve, we certainly would have sent them back to the orthopedist or referred them to an orthopedist for that surgical consultation and intervention if appropriate.
And in your 30-plus years of professional experience, you have a pretty good eye for when that needs to happen.
Right.
Yeah,
after you see enough of them, you kind of get you kind of get the gist of how things go.
Right, the benefit of seeing
Right.
a very experienced doc.
I
That's
guess
one good thing about adding those years, Doc.
Yeah, I guess my gray hair makes me look like I'm experienced, right?
Gray. I thought that was platinum blonde I was
Platinum
married
blonde.
to.
Okay.
Oof. As I explain to people, all right, he's a big guy with big hands, and when you see him walk in the door, he's a cross between
Oh, no.
Kenny Rogers before all that unfortunate surgery and Santa.
Ho, ho, ho.
Well,
And you got to know when to fold them.
and he's a jolly old guy who
Jolly
plays
old
plays a hand or two.
Yes, I do. I've been known to play a hand or two of poker.
All right, Kenny Santa, back to the topic here.
Okay.
One other thing I wanted to ask you about that we hear so often is that quote unquote, yeah, but if I go to the chiropractor, he's going to crack my back.
Oh,
And,
yes.
And it's frustrating for you, I know.
It's a pet peeve of mine.
And also, it's the one thing that kept me away from chiropractic care because I didn't grow up with it. And it kept me away for a long, long time. And when I finally went to a chiropractor, it was like, it's a miracle. I can run again. It was like, wow, where have I been all this time? What a knucklehead.
Well, certainly the term, he's going to crack my neck or he's going to crack my
Yeah.
back. That's kind of a pet peeve of mine only because it's not a real accurate term of what I do.
Right.
That cracking sound, the term cracking kind of has a negative connotation to
It
it that
does.
you're going to
It's
break
scary.
something or that it's going to get cracked. That's not really the truth of the matter. That sound that you hear when you're adjusted by a chiropractic physician is called release. And it's basically a sound made by a joint that's moved very quickly. Some people seem to think that maybe it's like breaking the vacuum of the joint. Like if you think about having a glass upside down on a counter in a puddle of water, and you try to pull the glass up, it has that little bit of a suction vacuum to it. And then you finally pull it up and you break it, it makes a little bit of a sound, a cracking sound. That's kind of what's going on in the spine. But I always want to have patients not think of it as I'm going to crack your neck, but we're going to restore function. We're going to adjust things. We're going to move them around and get them to get to working like they're supposed to. And the sound that you hear is just a sound, and it doesn't always have to happen every time you adjust a patient's spine.
And it mostly happens, you hear that sound, it's the loudest when you do the cervical or the neck adjustment
Yes.
because it's right next
That's
to
probably
your
true.
eardrum.
Yeah, that's true. That's true. And I can understand people's apprehension about that. But
I don't really notice the sound from, the thoracic or the lumbar spine, mid-back
yeah.
to low back as much as I do with the
neck.
Yeah, with the cervical or neck.
I think most patients are most apprehensive about having their neck adjusted. They think that, he's going to turn it too hard, he's going to break my neck. You think about these movies where the guy walks up behind his adversary and grabs his head and he cranks it to the one side and he quote unquote breaks his neck and the guy falls down dead.
Right.
That's just not very realistic. And the force that is applied by your chiropractic adjustment is so small compared to what would be required to cause injury, like you see on the TV show, that it's almost non-existent. So
I was going to say,
I just would like to educate you
possible is
listeners
that?
out there that I'm not cracking your neck. I'm adjusting your neck or your back or your low back, and that I'm restoring functionality.
Right.
So it's a little bit more of a complicated matter than just cracking the neck. Okay?
Right.
So you guys got that out there?
So what's the new terminology, Doc? What should we
Adjusting.
say? Adjusting. Okay.
Are you going to adjust my neck or adjust my low back? I can
Okay.
live with that one.
So that sound that you hear should be a welcome sound
Yeah,
because that
absolutely.
means you're going to feel better.
Yeah, it means that we're doing what we need to be doing. And I got it, like I said a minute ago, you may not hear that sound, that cracking sound. Sometimes you adjust a patient and you don't hear the sound. It doesn't mean that they didn't have the adjustment that they
Or it didn't
required.
move.
So, the sound is not as important as getting the force and motion through the joints of the spine at the level you're trying to repair.
Is the sound you're talking about kind of like when people crack their knuckles, or crack their
that's,
fingers?
That's a good example. And I'm sure we've all sat in a car or a chair and twisted our heads to talk to somebody or to look behind us because someone's honked a horn, and we turn our heads suddenly and we felt our neck go pop. Well,
or snap, crackle, pop.
yeah, that's just a release sound made by joints that are moved quickly. So, again, it's not cracking the neck, it's adjusting the neck or the back. Okay, did I clear that one up for you?
That cleared it up for me.
All righty.
Hope our listeners are
paying attention and then realizing that. And the other thing, too, is commonly patients associate adjusting with it hurting. It hurts when you adjust my neck, or will it hurt? And the answer is a good quality chiropractor that knows his stuff. It's not going to hurt. It might be uncomfortable, and it may not be the most pleasant experience that you've had, especially if you're in pain. But if you're in severe pain, first of all, I would tell you that I don't know that I would adjust you if you're in severe pain, because that would hurt. We would do what we need to do to get your neck or your lower back out of pain, or reduce the pain before we would start adjusting. So I think most chiropractors are competent in that regard, that they try to do everything they can to make the adjustment as comfortable and as pain-free as they can. Sometimes it might be uncomfortable, and sometimes patients get a little bit about it when they they hear that sound. But the bottom line is it really doesn't hurt.
Thanks for clearing that up, Doc, for our listeners. And
sure.
We're about out of time again.
Wow, already?
Yes, already. So I'd like to move on to the tip of the week. There's an old remedy that I've heard of with all of the colds that are going around right now. I thought maybe our listeners would be interested in this one. I've heard that you can use Vicks Vapor Rub to fight a cold. Do you know how?
How's that?
Well, I know you know how, but here we go. You spread it on the soles of your feet, and then cover your feet with socks and sleep overnight with it, or there's no reason why you couldn't just put it on your feet, during the day if you're a sock wearer, and that helps to fight a cold.
I'd like to hear from our listeners who may try that.
Anybody
to see
tried
if it
that?
actually works. I've not really heard that one, but hey, what the heck?
All right, so there you go. Well, that about wraps it up for another edition of the Chiropractic Corner. Dr. Volstad and I would like to thank you for listening, and don't forget to let us know what questions you may have for Doc or topics you'd like to learn more about by emailing us at I am as in Mary, CHIRO, the number 1, at gmail.com. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd love to hear from you. Google Volstad Chiropractic to find our website for more information about our office, or to listen to archived programs from the Chiropractic Corner. For those on Facebook, please search and find our Facebook page and give us a like. We post a lot of information about healthcare and natural remedies that you can use at home. Join us next weekend for another edition of the Chiropractic Corner, right here on WJUP, The Jupe, 103.9 FM, Friday morning at 9 a.m., right after the Dick Farrell live show, and again Saturday, right after the 10 a.m. news. Until then, be well, live well. We'll see you next week.